It is the second most frequent major surgery among reproductive women. Over 500,000 hysterectomies are performed every year across the country. And while the necessity for this procedure hasn't changed, the way it is carried out has changed tremendously.
The hysterectomy procedure has gone through several evolutions. Initially, hysterectomies were performed through an abdominal incision, which would take a long time to recover and would increase blood loss. There were also vaginal hysterectomies that were done, which improved pain and recovery time. In the late 80s, early 90s, we started doing them laparoscopically, and that improved recovery time and blood loss. And in the last 5 years or so, robotic hysterectomies have become more prevalent. The robot also offers an ability to do far more procedures laparoscopically than we could do with conventional laparoscopy.
In fact, robotic surgery is one of the most exciting surgical developments in recent years. What once sounded like a sci-fi storyline is now very real and making a dramatic difference in the way women undergo gynecological procedures like the hysterectomy. Using what's known as the Da Vinci robot, the physician is seated at a remote console just a few feet away from the patient and is positioned to view the entire procedure three-dimensionally in high definition while controlling 4 robotic arms. Each arm has a greater range of motion than the human wrist and eliminates the possibility of hand tremor, resulting in precision and maneuverability that would be impossible with traditional laparoscopic procedures.
The benefits of robotic hysterectomy are decreasing blood loss. They can also decrease the amount of pain that you have. And most women recover very quickly. I've had patients who are back to their regular, everyday activities within 2 weeks. The exciting new thing about the robot is that it can be used on procedures other than a hysterectomy. Pelvic prolapse, urinary incontinence, and more recently we've been using it for pelvic pain. And all these procedures can be done through the robot and improve outcomes and women's lives subsequently.
I didn't know a lot about it, but my surgeon was very informative and made me feel very comfortable and presented me with different scenarios of why I would benefit from this surgery. And he was correct. I was able to go home the day of the surgery with very minimal pain, and I was back doing my normal activities at 8 days after the surgery.
A generation ago, this would have seemed impossible. But today's advancements in surgical techniques are putting the most innovative healthcare solutions at our fingertips.
The technology's been around for a fair amount of time. However, it still has a lot of specialties that it can really break into to deliver better quality and safer care to the patients. Westchester Hospital is committed to pursuing any new technologies that will benefit the patient if it delivers an advanced quality and safety to the patient.
Westchester Hospital, a state-of-the-art medical facility closely affiliated with the University of Cincinnati, draws upon the university's over 200-year history of medical research and practice to deliver an uncompromised level of care and service. For over 50 years, Obstetrics and Gynecology Associates have been pioneers in women's health care within the greater Cincinnati area. Working together, Westchester Hospital and the physicians of Obstetrics and Gynecology Associates offer a wealth of experience in piloting medical breakthroughs. The dedicated staff believes in offering the most advanced medical care available and investing in the latest clinical technologies like the Da Vinci robot. The physicians here are some of the most proficient in performing robot-assisted hysterectomies and other minimally invasive gynecological procedures.
It's critical to have Da Vinci robot surgical system inside the community hospital for better care of the patient. One, the patient doesn't necessarily want to travel to a complex center in the middle of a city. Two, there's a lot of evidence showing that when a support system is at their side, there's better recovery. The third is when a patient goes into a hospital for operative procedure, and they have to go to a hospital where they normally don't receive their care, their particular cardiologist or their gastroenterologist may not be at that hospital if a consult is needed.
As far as gynecology is concerned for the robot, the articulation of the instruments along with the stereoscopic view, we're able to see the pathology much clearer, and we're able to do a more extensive and healing dissection. And it's important that women have those choices and be able to make informed decisions for their health care.
I feel very fortunate that I was presented with this option. The robotic surgery is a procedure that can get women back on their feet quickly with less complications, and in my case, 0 complications. And I would recommend this highly to anyone.
Westchester Hospital is a regional provider of world-class medicine and prides itself on delivering outstanding patient experiences. Learn more by visiting uchealth.com/Westchester Hospital. For care beyond compare, look to the medical professionals at Obstetrics and Gynecology Associates. To learn more or schedule a consultation, visit cincyobgyn.com or call 513-221-3800.